you a cordial welcome to all of you. I'm delighted to be here and to tell you a little bit about NADH, and a special welcome goes to Karina Hopkins and her wonderful daughter. He came all the way down from the San Francisco Bay Area to listen to my talk. I hope I will not disappoint you.
I have no concern.
Since you have tried the product already and are still alive, I think it's a good choice. You can convince the other people. Yeah, that's a good product. But let me. Oh yeah, I got it. I will give you an outline what NADH is, its biological function, and its therapeutic application. What is NADH? For lay people, NADH is the biological hydrogen, the biological form of hydrogen, and that tells you the story, because hydrogen reacts with oxygen and makes energy and water. So NADH is the fuel for energy production in every living cell, and there is no cell which does not contain NADH. Now the abbreviation is nicotinamide adenine dinucleotide hydride, also called coenzyme 1. But my personal abbreviation is Nature's all-day high. So if you can recall that at the end of my lecture, I can guarantee you are not suffering from Alzheimer's dementia. Now NADH is produced in our body. We do have a lot in our heart. Do you know how often the heart pumps per day? You can easily calculate, but I will tell you it's 85,000 times a day. So the heart needs the most energy. And also we have a lot of NADH in our muscle and in our brain. You may know that 1/3 of the energy we do produce in our body is used up by the brain. Only some people use much less. We have also NADH in the blood, and it's made from protein and carbohydrate and lipids. And we end up with glucose, and glucose is metabolized, and at the very end you find NADH. So we have NADH in our body. It's a natural substance. The biological function, NADH catalyzes more than 1,000 functions in our body. But I will focus on the 6 most important. The first is it's the fuel for cellular energy. Second, it can repair damaged cells and DNA. It's one of the most effective biological antioxidants. It stimulates the immune system, and it also stimulates adrenaline and dopamine, and you probably know dopamine is regarded as our pleasure hormone. The more dopamine you have, the better you feel. And newer results, it stimulates nitric oxide production. Now, let's come to the fuel of cellular energy production. There is a central question. Can we increase the energy production in our cells? And I say yes, by NADH. And you will immediately ask, show me the evidence. And here is the evidence. At the University of Graz, where I'm professor, we took isolated heart cells, and these cells still. No, sorry.
Take your glasses.
The technique. Here we are. So this heart cell in tissue culture still contracts. I don't know why it does now, but see, it's still contracted, it's still alive. Now if you add NADH to the cell medium, the biochemical expert will tell you nothing will happen, because NADH is supposed not to enter the cell. This is the dogma of biochemistry. But this dogma is false, as many other dogmas. If you put NADH in here, you know what you get? You get 30% more ATP in these heart cells. And what is the consequences? I mean, we have published that in the British Journal of Pharmacology, but the consequence is the heart cell lives longer. The heart cell lives 50% longer. So this is the first scientific evidence that NADH has a life extension effect. And the practical consequence, we did a study at the University of Kiev with Professor Birkmayer, and you can see outlined, there was a patient with heart insufficiency, and in between 2 weeks, with 40 milligrams, with 2 tablets of our rapid energy, you get an increase up to 28% of the pumping power of the heart. Now, NADH is also essential for DNA repair, and the more NADH you have, the better the DNA repair works. And this is very, very important, because the older we get, the more damage we have in the DNA. If you damage the DNA by doxorubicin, which is a frequently used chemotherapeutic agent, the DNA gets damaged and can be repaired by NADH. NADH is a highly potent antioxidant. It reduces lipid peroxidation. You know, lipid peroxidation makes the cell oxidized, rancid, and the cell dies off. It normalizes cholesterol and it lowers blood pressure. That has also been published. That was a study in collaboration with Georgetown University in Washington. All what I'm saying is substantiated by scientific, solid scientific study. Not fairy tales, you know. You have an energy drink which gives you wings, and you jump out of the Empire State Building and waiting for your wings, and they're not coming. Anyhow, what makes me very proud is a statement from Richard Passwater, one of the experts in automolecular medicine, and he said, well, there is no such thing as the most important compound in our body. NADH comes as close as a single substance can. That makes me really proud. Now, NADH stimulates the immune system, and we have seen that in several times. We have also a few AIDS patients we do improve. I just got an email the last week. It stimulates interleukin-6, which is a neuroprotective factor. It stimulates NADH, adrenaline and dopamine, and these are all the features which improve if you have enough adrenaline: mood, power, cognition, attention, energy, coordination, and sex drive. Now, this has also been published, and the very newest result is that NADH stimulates nitric oxide. Nitric oxide is a neurotransmitter. It's like oxygen, and it relaxes blood vessels. And that means the more nitric oxide you have, the better the function of the organs, the more blood into the organs. Now, since nitric oxide stimulates blood vessels, it helps with angina, asthma, migraine, and also the genital organs get more blood. We have taken advantage of that. We have a combination of NADH and arginine, but therapeutic application. Now, I have to tell you that my late father was the discoverer of the classical therapy of Parkinson's disease. In '61, he discovered L-DOPA, which is now the classical therapy. And he got patients from all over the world, including Mao Zedong. But many Americans, also German, patients were, overloaded with L-DOPA. And let's put it this way, that was such a high dosage that L-DOPA did not work. And the patient, they're shaking, and also they're stiff, and became, moveless. And he asked me, George, I paid your study in biochemistry. Think of what we can help. So I looked up the biochemistry textbook, and L-DOPA needs NADH. So I offered him NADH, and he used it in a patient. And I want to show you a 3-minute video what this patient looked like before and after. Here we are. That was a 55-year-old patient showing the typical symptoms of Parkinson's disease, as you may see in a minute. And he got an infusion of 25 milligrams of NADH.
The classical therapy of Parkinson's disease is substitution of the dopamine deficit by its precursor L-DOPA. We have developed a new therapeutic concept: the stimulation of the endogenous L-DOPA biosynthesis in the brain of Parkinsonian patients by NADH. Its beneficial clinical effect is demonstrated on 3 cases.
Wir wollen zeigen, was diese neuen Medikamente bei ihrer Krankheit können. Sagen Sie mal das Wort Elektrizität.
Elektrizität.
Artillerie.
Artillerie.
Ja. Und jetzt stoßen Sie mal mit den Händen nach vor.
This patient is a 52-year-old biochemist working in an analytical laboratory. He suffers from Parkinson's disease since 4 years and was treated with Madopar, the classical medication. In spite of this therapy, his disability deteriorated and could not be improved even with higher dosages of Madopar or other additives. The patient has difficulties in getting up from his seat and in walking.
Und jetzt gehen wir
He
geradeaus.
moves forward in small, tripping steps. After infusion of 25 milligrams of NADH, the patient's disability improved considerably. The mimic was more animated, the pushing and jumping ability was incomparably better to that before the NADH treatment.
Jetzt wird gesprungen. So, und jetzt
His walking was remarkably improved. The left screen shows his walking before, the right screen 1 hour after NADH treatment.
This patient, and you should know, this was done in 1988, so 25 years ago. And this patient is still alive in the same condition. He's now 82, he's doing walking, etc. And I want to show you another picture. You may recognize this young boy here. And this is my late father in summer of '96, and he passed away in December '96, and he was the discoverer of the L-DOPA therapy. Now, the problem I had, you know, he's had a lot of patients coming from all over the world, and after they were treated in his clinics and they went home, they had nothing to take. So he said, you must make me tablets. Easier done than said, or easier said than done. We took NADH, blended it with milk sugar, the most common filler of tablets, compressed tablets, and after 4 weeks in the refrigerator, all NADH was gone. To cut a long story short, I pointed it out, NADH is a very sensitive substance. It reacts with air, with oxygen, with water, and with oxidizing compound. So lactose is an oxidizing compound. So it took us 4.5 years of extensive research to find the stabilizer and the filler which did not react with NADH. And we found it, and we made a bioavailable form of NADH, absorbable form, and we got worldwide patents for this formulation of NADH in stable form. And to let you know, there are a number of fake products on the market. They are unstable NADH, and if you have them analyzed and it says 10 milligrams, there are less than 2 milligrams into the tablet. This is consumer cheating, and you can sue them if you want, but it will cost you a lot of money, and it will have no effect because they will keep going. Now, we did studies on Parkinson's disease, more than 800 patients, also with chronic fatigue, and with Alzheimer's disease, and also with depression. I want to just outline and summarize the individual studies. 470 patients received NADH intravenously, 425 orally, and 95% improved in terms of mobility, depression, etc. That has been published. The next, and yeah, this is a good point, that has been published by my father and me and some colleagues. And these studies were confirmed by colleagues in Germany. You know what that means? If German colleagues confirm Austrian medicine, this is sensational. So it is, definitely. So this is the publication from the German group. They confirmed the study. Now, chronic fatigue, we did a study at Georgetown University in Washington, and we found that 22% of chronic fatigue patients improved after 6 months. What we learned, we only used 10 milligrams which is much too low a dose. Now we are giving chronic fatigue patients 60 or 80 milligrams. That has also been published by Georgetown University, and Alzheimer's dementia. We did 2 FDA-approved studies. We submitted the documentation with all toxicology, chemistry, as you will see here. We submitted that, and in between 4 weeks we got approval from the FDA. We can start with the study because our substance is so safe. Usually it takes 6 to 9 months to get approval and go decision from the FDA. And here are the results. Georgetown made a study with 17 Alzheimer's patients, and after 6 months they found a slight but significant improvement of certain cognitive function. This is so far the first and only substance which leads to an improvement. I mean, the 3 or 4 Alzheimer's medications which are on the market, they do not improve, but they only slow the progression. And Aricept, the best-selling Alzheimer's drug from Pfizer, Pfizer admits that Aricept only works in 2/3 of the patients, but they sell it to the rest. And now Pfizer pushes Aricept as a prevention for Alzheimer's. But let them go. Anyhow, there was another study at the University of Zagreb with 47 patients, and also there was an improvement, which is summarized here. This was the beginning of the study, and after 6 months, this bar shows the NADH group, which is an improvement, and this bar shows the placebo group, which you can clearly see a decline. You know, the problem was to find patients with the same degree of disability, but we published that with several publications. That was the product we were using, and the age constant energy was a 10 milligram tablet, and we only treated them with 10 milligrams, which is again much too low now. Depression. My father did the study and found out that 90% of the patients improved, but the funny thing is some after 5 days and some took a year to improve. So not every depression is the same. I have one depressed young boy with 35, and he suffered from depression for 7 years. He took all antidepressive and he experienced all the side effects you can imagine. And then he looked up the internet and found, oh, NADH is an antidepressive. I go to the pharmacy and buy NADH. So we bought it, but it was not our product. This was a fake product, and it did not work. And they say, oh, Birkmayer is a crook, that doesn't work, everything is junk. And by chance, he found our product. And he wrote me an email and said, after the 2nd tablet, I experienced an effect. Oh. And this is, I mean, really incredible. And you can try it out. I mean, as I will show you later, we did see an effect in 10 minutes. There is no supplement in the world where you can measure the effect after 10 minutes. We have at least 4 or 5 medical instruments where you can measure the effect of NADH. And we discussed it at lunch. There is a game in the iPod or wherever, you know, where you can measure reaction time. If you play that game and after a minute you have a reaction time, let's say of 20 seconds, then you take NADH and next you have a reaction time of 10 seconds. NADH and cancer is a very important subject, and I just want to outline you what the different theories are, how the cancer develops. Either the cancer develops from genes, from the nuclear genes, or from the cytoplasm. But let's take the carcinogen binds to DNA, and if there is no repair, you get a mutated to repress DNA, which promoters like smoking, like any kinds of other toxin, enters into altered mutated cells, and then cancer develops. But you can interfere with this reaction. If you have no repair, if you give NADH, you have DNA repair, and you end up with normal DNA. If you have anti-promoters, and I showed you at the beginning that NADH is an anti-promoter, you don't get cancer. And with the altered mutated cell, you can increase cellular energy. And this is what I keep saying to my students. This is a cancer cell. Very low in ATP. ATP is the chemical stored form of energy in the mitochondria. And cancer cells have low energy. They have low mitochondria. They have no power plants in their cell. and therefore they cannot produce all the substances which are essential for cell regulation. But if you get NADH into the cell, as we have shown, then the cell makes more ATP, but more important, it has enough energy to make cell surface compounds. And these cell surface compounds control the cell regulation. They control whether a cell will divide or not. And the more ATP you have, the better this function works. So I want to demonstrate one or two patients and then the summary with all my patients. 2 weeks after September 11, a manager from the Netherlands came to my office in Vienna. And his professor in Amsterdam told him, make your last will, you will not survive until Christmas. He had chemotherapy, as you can see, all kinds of radiotherapy, nothing helped. It was a tumor very close to the heart and was inoperable. He started with NADH and 40 milligrams, which we now know is even too low. And in July, 9 months later, no tumor detectable. And March, I called him because I wanted to invite him to a lecture where I invited all my cancer patients. And he said, sorry, I can't come, I'm too busy. But most rewarding for me is that he writes me every year a Christmas card. This is much more rewarding than any prize. And I have another patient, a female, bronchial carcinoma, November, a year ago, and the control, computer tomograph a month later, and it shows there was a 5 centimeter tumor on the apex of the lung and a small other tumor. This patient took 160 milligrams, 8 tablets of our rapid energy, and the small tumor could not recognized anymore. So the tumor was gone after 4 weeks. And the big one was centrally necrotic. So something happened, maybe the immune system or NADH, which destroyed the tumor. And yeah, and that says centrally necrotic tumor. That means NADH had effect in destroying tumor cells. Now, another patient with a non-Hodgkin lymphoma, he had all kinds of chemotherapy and also radiotherapy, and it did not help until January 9. And this is a remarkable slide. He came to my office and showed me a lab report. And I said, who did this red circle? Because it says the white blood cells were 4.6, the red blood cells 14, and so on. And I said, was it you? I said, no, it was the doctor. Because the doctor was surprised that under this heavy chemotherapy, the blood cells kept normal. That means if you are on chemotherapy, NADH will protect you from the side effects of NADH. And this is, I will skip that slide. He said, then he stopped with NADH, and the tumor came back after 9 months. And they had a biopsy done, it was the same tumor. And then they said, you have to make chemotherapy again. And I said, no, I will stick to Dr. Birkmayer's philosophy, I only take NADH. And now, October of this year, no evidence of lymphoma. And he started 11, so that means for 2 years he's now no evidence of disease. And this is a summary of all my cancer patients I have treated since 2009. We have 21 prostate cancer patients, no surgery, no chemotherapy, no radiotherapy. And to explain it a little bit further, TR means tumor regression and TF means tumor free. So prostate cancer, mammary carcinoma, lung cancer, colon cancer. We have also bladder cancer, non-Hodgkin lymphoma, brain tumors, and gastric carcinoma, as well as pancreatic carcinoma. So this is the same in English, sorry. And based on my results, I was invited by Dr. Harry Bruce and Bali to write an article about NADH in cancer prevention and therapy. And some of this article is outlined in the brochure you have already received. NADH in diabetes. I had a patient with, these values, 360 blood sugar, which is quite high, and HbA1 was also elevated, and he started taking NADH, 4 tablets, which means 80 milligram, arginine, chromium, etc. And interesting, after 2 weeks, he was in the therapeutic range recommended by Roche. So it took only 2 weeks to get him down. And there's another patient, actually it's my cousin, and he developed a diabetes. You see the high values.
Oh.
Yeah? And that was from March to May, in between 3 months, he could downgrade his blood sugar to 77 and HB like 64. And he's taking NADH 4 tablets, and I saw him 2 weeks ago, he's in good shape, and his blood sugar is in that range. So we treated about 24 patients with diabetes, and all came down to almost normal values. But the point I want to make, we have 3 patients which got a certificate from the University Clinic in Vienna that they do not need any anti-diabetic medication. Can you imagine? The clinicians which want to prescribe thousands of different drugs, right? You don't need any medication. So it's good news for the diabetes. This is the product I'm talking about. I have brought only 3 boxes because I was afraid of the customs. But if you can have 1 blister and you try it out, I can guarantee that you will realize an effect. And my granddaughter Natasha will, after my lecture, will give you a blister of each. I think we may fit. We have about 18 blisters, and we are 18, so it will work. And you got yesterday one, so you're out of game, okay?
You're good. I'm good.
Now, I did tell you about Alzheimer's dementia. This is cognitive impairment. But then I asked the question, what happens to healthy individuals, middle age, between 30 and 50 years, and when they suffer from sleep deprivation? So we did a study on Cornell University, and they got 20 milligrams, 24 hours without sleep. They were kept awake, not by knocking on his shoulders, but with EEG, computer-assisted electroencephalograms, and 24 hours without sleep. One group got placebo, the other group got NADH, and then there was so-called crossover. After 6 weeks, the placebo group got NADH and the other group got placebo. And the results are summarized here. That was a baseline test. Visual perception, how you can recognize certain things like, the light at the crossing. That was the visual perception after 24 hours sleep without NADH. You see the visual perception goes down dramatically. It's comparable to an alcohol content of 1.5 per ml. But if you take NADH after 24 hours without sleep, you are 3 times better than after a full night's sleep. But that doesn't mean that I recommend you don't sleep and take NADH. But if you have a sleep deprivation, a sleep deficiency, or if you feel tired, you take it and you will see the effect. But again, this effect has been substantiated by a controlled clinical study, FDA approved, etc. And that was published by Cornell University. You can see effectiveness of NADH, alleviating sleep deprivation in healthy middle age. And you're all middle-aged, so you will all benefit from it. Okay, this is a video from ABC Good Morning America. I can skip that. Now we come to the application of NADH in the eye. Yeah, it proves glaucoma. After 4 weeks, if you take NADH, the pressure, the intraocular pressure normalizes, which is very important. And as you can see here, this is elevated and this is the normal range. And that was the doctor in Germany. She did the study and found out that also the blood pressure normalizes. She has published that. And this is the product. This is a combination of NADH with L-arginine. And NADH and L-arginine makes nitric oxide. And nitric oxide, relaxes blood vessels, so you get more blood into the vessels and also into the eye. And what this doctor showed that there was a revascularization of blood vessels in the eye, an improvement of vision. So this is NADH vision. Macular degeneration. There is not a single substance, not a single drug which works effectively for macular degeneration, except NADH vision. We know that it leads to a revascularization of macular blood vessels. Again, NADH vision is NADH plus L-arginine. Arthritis, we developed a product based on NADH and glucosamine sulfate and chondroitin sulfate and with MSM, and it relieves joint pain, it improves the mobility, and it gives you more physical exercise. And I'm taking this arthros because I have problems due to my polio, my early polio. I have a problem, and if I walk longer, I have pain in the ankle. Since I'm taking arthros, I have no problems at all. But this is a 75-year-old patient. But this is, for me, the most impressive patient. This was a doctor, female doctor, and she was marathon runner, and she could not walk without pain on the street. And as you can see, 8 weeks after there, she runs marathon again. A doctor. She was very critical. She could not believe it. But now she's convinced. Dermatological application. We developed a serum, a skin serum, based on NADH and liposomes. You know, liposomes are little fat droplets, and we succeeded in inserting NADH into this droplet. And the liposomes have the ability to transport the active ingredient into the skin. And we did a study at the University of Freiburg in Germany, an anti-wrinkle effect, as you can see. And 2 weeks later, and that was computer-assisted photography, and this is for comparison here before and 2 weeks after. But we have some VIPs, people, very important person in Austria. She is a musical star in Germany, and she had severe acne for years as a musical star and actress. And she visited a number of dermatologists with no result. 2 weeks after the skin serum, the acne was gone, and she was happy, and she's still taking it. And there's another VIP. You probably know her. Can you imagine? She tells that it works. That's really unbelievable, but it's excellent. But this is for me most impressive. I know Dr. Bradstead for 10 years ago, and I met him by chance in Frankfurt in May, and I gave him a skin serum for his wife, and you can read it. I mean, a wife of a doctor, if she admits that it works, it's like, the Bible. We did a study on teleangiectasin, which I think you know as spider veins, with the University of Freiburg, and the result is there was significant improvement in the teleangiectasis, which is the Latin word for spider veins, with no exception, and usually to complete healing. Not only here in the face, but also on the leg, etc. And I want to point out that our skin serum is unique in a sense that it contains only one ingredient and one carrier, whereas the most common, many cosmetics, they have, let's say, 5 ingredients and 20 preservatives and antioxidants and crude oil residues or whatever. So this is the advantage. And we have shown that it helps in varicosis, aging spot, wrinkles, rosacea, etc. It's transdermal, it's energizing, and it's regenerating. If you have a damaged skin and you put, or if you have a wound, or if you have a burn blister, you put it down, next day it's gone. This is a patient with a severe, so-called rosacea, severe form of acne, 2 weeks after serum. This is a diabetic patient with an ulcer on his big toe, 4 weeks after skin serum. They wanted to amputate his foot, and now he can still walk. Dental application. We developed a dental gel, also on the basis of the liposomes, but we added argan oil. Argan oil is a very energy-rich oil, and it makes NADH more effective. It has some sort of synergistic effect, and we did two what we call application studies with a dentist in Germany, and see restored cell scuffing, stops bleeding, regenerated the damaged gums, and also after implants, tooth extraction or gingiva plastics. And one of these doctors showed that parodontosis improves in 4 weeks by 4 millimeters. You know, if you have these deep lashes into the gum. This is the recommended daily dosage for NADH. Healthy people, 1 or 2 tablets. People under stress take 2 or 3. And chronic fatigue or chronic ill should take 3 to 6 tablets. And cancer patients should definitely take much more. And the most frequently asked question is, how safe is the product and are there any side effects? And I can tell you that NADH is one of the safest supplements on the world. You can take 1,000 milligrams of NADH for 6 months without any side effect. And 1,000 milligrams is 50 tablets rapid energy a day. We did the study. Yeah? So you can hardly eat that, or you can hardly afford to buy that. Here's the result. Yeah. Now, it shows no side effects. We had to document all the side effects in our studies, FDA-approved studies, etc. We have experienced no side effect. But we have, and for me more convincing is that we have a lot of customers, particularly in the United States. And you know, if a woman burns at the McDonald's coffee, she sues McDonald's and wins the case. We have never received a letter from a lawyer, but we have received many, you know, what shall I say, recommendation that's good. So, also important, no interaction with the most common drugs like antidepressant, antihypertensive, and anti-allergic. Yeah, and this is a comment on fake product. The fake product have 2 possibilities. If NADH is not stabilized, they are gone in 1 month. Forget it. And the other group, they fake, or they try to infringe our patent, but even in that case, they failed and did not come up with a stable product. And I think we have tested about 90% of the NADH product on the market. Not a single one meets the specs. But what can you do? I cannot tell, you know, 2 billion world population will keep, watch out, these are defect products. And they take it, and this is my concern, not the profit they are making. My concern is people take it, say no effect, the Birkmayer substance is shit. That's my concern. And it took a lot of work to convince people, and now we are planning to have a website on the quality assurance, not only of NADH product, but also of other food supplements. And there is a lot of junk food supplement in the market. Yeah, to give you an idea here, Rapid Energy, our product, the spec on the box is 20 milligrams. The NADH content detected is 20.5, 105%. And there are some products, the content on the label is 20 milligrams, and best 2.3, 0.77, and only 0.29, so almost nothing. And there are some other products, you know, the best has 69% of NADH. The original Birkmayer product is George Birkmayer NADH registered trademark. And these are some reports of NADH consumers. And I don't want to comment it because you can read it by yourself. The product is a miracle. Do not fatigue as easily, I'm impressed, etc. And we got more than 500 of these, you know, comments. You got this already, and yeah, if you have questions, you know the Chinese proverb, there are no stupid questions, there are only stupid answers. So I will try my best not to be stupid. He's the moderator, so he gives.
Did everybody get a brochure? No. Okay.
I have a Dr. Birkmayer,
Yes.
have you done any studies on children? Does this
Well, not studies, but application.
application?
We have seen tremendous effect in attention deficit hyperactivity, and Dr. Bradstreet, I mentioned, did the same, but they were not controlled, placebo-controlled studies. But it's definitely better than Ritalin. Ritalin is, I don't want to comment on that. It's pushed by the pharma industry. It's on the doping list. We are not allowed to take Ritalin, nor our athletes. But our children in school are forced by the teachers to take Ritalin. And those students which do not need Ritalin, they sell it to their colleagues. So it's a black market. It's incredible. But I can only recommend you, if you have, a son or a grandson or a daughter in school, take one of the rapid energy when they go to school, and their performance will increase remarkably. Yeah.
So I'm not sure, is not NADH on the WADA list?
On?
The World Anti-Doping List.
I couldn't
Is
get
it, I know it's is it a synthesized product or a natural product?
No, it's a natural product. It's derived from yeast. We do not produce our NADH. The NADH is produced by Roche, by the Roche company. 500 kilograms a year. And there is no trace of yeast left. They make an extract, and then they run it from a 3-floor column down and end up with NADH. So it's absolutely natural, not synthetic.
Okay, and WADA is the World Doping?
What?
World Doping, like athletes can take
Very good question, yeah. We have a letter from Dr. Shamash, the medical director of the IOC, that NADH is not doping. We have a letter from the German Anti-Doping Association that NADH is not on the list of the prohibited substance, and it will never be on the list because we have it in our body.
Right.
And if you take 20 or 100 milligrams, we cannot measure it in the blood because it's immediately metabolized.
Right.
So for athletes, it's absolutely beneficial. Please, yeah.
Yes, there was a question on the pricing on the paper. It says 70 euros, and on the bottom of the brochure it says 7.
The brochure is 7 euros, and on the order form it says 70. Thank you for the comment.
Hopefully it's
to look
the
at that.
7 euros.
Well, it's definitely 7, but you got it free of charge.
So the brochure costs €7.
Right.
Okay.
But Natasha, can you now try to distribute these blisters? If you want, do you want blisters of any idea?
So is it 7 or 7?
The brochure is 7.
Yeah.
So the price. What?
No, it's 7. It's 7. It's 7. It's a comma. Yeah.
Oh, so the brochure is 7.
And here's the brochure is 7.
Right. Okay, so the price on here is for the brochure, but the brochure is free, right?
Okay. Where is it?
Here they are.
Is it best to take it in the morning or in the evening, or when is it?
Morning and noon time, because it activates you, as you will realize. If you take it in the evening, you may not sleep, you may not fall asleep, and it takes until midnight, So I would recommend to take it in the morning and then at noon time, depending on your workload. And so if you have a night job, then you can take it in the evening, of course. Yeah.
For cancer patients, is there any advantage for taking it through IV over taking tablets?
What? I couldn't get.
For cancer patients,
Yeah.
is there any advantage taking it intravenously compared to taking the tablets?
Well, it certainly intravenous is an advantage, but intravenously NADH is a drug, and we do not have it available.
So that is not available yet?
Not yet, not yet. As soon as we have the approval as a drug, and we are working on that, in terms of Alzheimer medication, we are in phase 3, the final phase of a drug submission. It will take another 2 years and a couple of $1 million to pay for the multi-center study. But if it's registered as a drug, then we will have the IV, the parental form available. But the tablets work almost as fast, and the fastest action you have from the skin serum. I have a friend who does kinesiology. You know what kinesiology is? If you, yeah? And he did a test, one leg stand, and the patient takes the arm, or a doctor, and he pulls him down with 2 fingers. then he takes the spray, and after 5 minutes, the doctor stands stiff, and he cannot even, push him down with his entire body weight. And in between 5 minutes. Yes, yes.
Could you elaborate on the treatment for macular degeneration?
Yeah. I have a doctor from Bulgaria, a female doctor. She could not see me. She could not even see my contours. And she took our NADH vision, and after 6 months she could recognize my face with, not very focused, but she could. And she told me she can read with a hard, magnetic lens, with a magnifier. That's an improvement. And we have about 5 or 6 patients of my own, and this doctor in Germany has much more. So it's definitely a benefit. But it does not work overnight. I mean, it may need 4 or 6 months, but it will definitely lead to an improvement. Yes, okay.
The cost and how would we order it?
Order it, yeah. Either you fill out the order form and fax it, or by email, or by our website. And we have contact with Visa and Master.
And the cost is different than what's on the sheet, though, because that's euros, right?
Yeah, right.
Okay. So the cost, again, American?
Yes.
The card, American.
Could be
Well,
like
we.
$90. It depends on the.
Yeah, right. Yeah. It's about, for the rapid energy, for the 20 milligrams, it's around $90.
Ja, sag bitte, dass man das sublingual nehmen muss. Hat jetzt eben
I forgot to mention that the rapid energy is a sublingual tablet. You
So
have
the samples that are being handed out.
You should put it under the tongue, and it will dissolve in less than 2 minutes.
And they're 10 milligram or 20 milligram?
This is 20 milligrams.
20 milligram.
Yes.
What is I only got a glimpse of it on the screen, what is the protocol you use for the diabetes, including, besides this, there are other supplements you were using to treat type 2 diabetes, which is what I'm contending?
Yeah, the protocol is that I give my patient 60 milligrams daily on NADH.
Okay.
And then we measure chromium and zinc, and if they have a deficiency in chromium or zinc, we substitute that.
Chromium and zinc.
Yeah, right.
Okay.
If there is a deficiency.
If there's a deficiency. Okay. And there wasn't like arginine or anything like that.
In one of the patients we gave arginine.
Okay.
Yeah.
And in what case would that be used?
Arginine you need at least 1200 milligrams per day, because otherwise arginine will not enter the cell. We do have arginine in the cell, so you have to have a higher pressure outside to get arginine into the cell. And this is accomplished by 1200 milligrams of arginine.
I see. Is it necessary though for the treatment of diabetes?
For diabetes? No,
Yeah.
not necessary.
Okay.
But NADH is necessary. And gives what we have seen also, that NADH improves insulin production.
Oh.
So we are reluctant to give it to type 1 diabetes because they inject insulin. And if NADH stimulates insulin production, they may have a low blood sugar. So it's very difficult. By my friend whom I met quite a while ago, Jonathan Wright in Seattle, he's giving that also to type 1 patients, but he controls the blood sugar level every 2 hours. And he told me, and we met him, you remember, in Cancun, that he got 3 or 4 patients off the insulin.
Right.
Good for the patient, good for Jonathan, but bad for the farm industry. Yeah.
Was that on type 1?
Type 1, yeah. But I'm reluctant. I do not recommend type 1 patient, insulin dependent, to take it, because if they don't control it, then they run out in a hypo, and that's risky. Yeah.
If you're on a B complex that has B3 in it, or you're taking that, you mentioned yesterday that perhaps is not a good idea.
Thank you, Connie, for that comment. Very important.
Yeah.
Some people claim that if you take high dosage of vitamin D3, you will experience the same effect with like NADH, which is absolutely not true. We did an athlete study, which I did not report on. Olympic athletes, 4 weeks of NADH have 10% more ATP in the muscle. That was tested by biopsy. And the control group took B3, 100 milligrams, no improvement. So, and vitamin B3 also NADH is the coenzyme form of vitamin 3. Vitamin B3 blocks the effect of NADH. We don't know why, but it does. So I'm not so fond of vitamin B3 because many, but B3 complexes makes or causes rashes and allergic reaction, etc. And yes, please.
So, if you're taking a number of Medicare or supplements,
yeah.
taking NADH would be beneficial, and you could stop taking like B complex and vitamin D3 and iron and.
I would, yeah, absolutely, I agree. I mean, if you take other supplements like selenium or vitamin E, I advise my patient to do a test, a blood test. If you have a deficiency in selenium, then you should take selenium, but you should not take, compounds from A to Z. We did in our research laboratory, for example, we did analysis. We took vitamin A, C, and E into gastric juice. And all the supplements end up in the gastric juice, which is very acid, is 100 times more acid than vinegar, and is 37 degrees. And we found compounds which we could not identify. So this multivitamin is, for me, it's a wrong philosophy. Take what you need. And to point out that all people, not only you, but even Olympic athletes, have an NADH deficiency, because otherwise they could not improve, as we showed.
Well, from an economic standpoint, you could wash out because you stop buying the supplements and buy this and take one and one way.
That's a good comment. I mean, I agree. I totally agree.
All right.
You benefit more from NADH than from hundreds of supplements,
including C and E.
Yeah. But I can make another comment. Everybody believes that vitamin C stimulates the immune system. The biggest producer of vitamin C is Roche in Switzerland. And the Roche in Switzerland admits in their annual report there is not a single scientific study showing that vitamin C stimulates the immune system. This is just in the brain, and they have PR agency, their marketing agency, that vitamin C stimulates the immune system. But what vitamin C does, it protects you from the damaging effect of smoking. And NADH does that as well. We have a study with smokers at the University of Graz. If you smoke, you can measure the damaging effect of smoking in the blood after 10 minutes of your cigarette. If you take NADH, the damage is only 10%. So for all smokers, NADH is a must.
Or stop smoking. Or stop smoking.
Or stop smoking.
Save more money.
Fine, so yes, please.
I'm trying to understand the invoice here. It says package including 10%.
Oh, that's the, including the value-added tax.
VAT, yeah, including the VAT
tax.
The MWST is the German for value-added tax.
Okay. For the 10% tax.
Do you have a clinic in Austria?
No, not anymore. I had it until 7 years ago. But I'm rather an old guy, and I'm focusing only on NADH, and that keeps me busy. Can you ask my spouse? We are traveling, quite. I would say every other week we are in Czechia, we are, in Germany giving talks. I invited to talks. No, but to answer your question correctly, I do receive patients. If they want to see me, they can come to Vienna, and I do not do telephone treatment because I want to see the patient.
Sure.
Because then I can judge what he needs and how he's feeling.
Okay. Well, I have a sister-in-law in Vienna, so I have a sister-in-law in Vienna.
Yeah, right. I think this is Vienna.
Yeah.
But yeah, here you have my website, and you can contact me by the website.
Did you say
Yes?
that patients on chemo, this doesn't impair that or aggravate the treatment? Is
What
that
do you mean?
also patients on chemotherapy?
Yeah.
It does not have an effect?
No. What we learned that we have two types, or I have two types of cancer patients. One decide to take chemotherapy, and that they don't miss anything. If they take NADH, 80 milligram, they have much less side effects. And the other group say, no, chemotherapy is killing by prescription. they are doing much better. They're recovering much faster.
But it doesn't prevent the chemo from working. It doesn't
No,
prevent.
yeah, that's a good point. No, not at all. But the question is whether chemo works at all.
What about someone that's on chemo and radiation, really getting dosed?
Yeah, he should take NADH, and he will. I just got an email from the ambassador, Austrian ambassador of Alger in Algeria, and she had a friend. She was on chemotherapy, and she says she tolerated the chemo much better with NADH. It's my recommendation. If one decides to take chemotherapy, then she should take NADH. I gave a lecture at the Princess Schwarzenberg. She has a special lecture program in Vienna, and I spoke about NADH and cancer. And there were mainstream colleagues as well as homeopathic and automolecular. And at the end of the talk, I raised the question: is preventive chemotherapy meaningful or not? If you have no tumor, if your surgery removed, etc., no tumor in the body, most mainstream doctors say you have to take preventive chemotherapy. Now, the good thing on chemotherapy is it kills all fast dividing cells, including the hair and the mucosal cells and also cancer cells. But after stopping chemotherapy, the mucosal cells in the hair came back, and so the cancer cell will come back. So chemo has no effect. But if the cancer cells do not come back, they were not there before the preventive chemotherapy. So I didn't get any reasonable answer on that. Yes?
Have you had any experience with treating people with NADH with hepatitis or HIV?
Yeah. Hepatitis, particular hepatitis C,
yeah,
the titer goes down, not to normal range, but considerably.
Okay.
And HIV is another story. HIV has never discovered. The virus is never documented, isolated. But what I see, and I have an AIDS patient with Kaposi sarcoma,
yeah,
and he took NADH since September, and I got his results, and the CD4 and CD8 ratio, improved. Not normal, but improved, and he feels much better, etc. So I think they should try it.
Yeah.
But it's very difficult to do controlled clinical studies in cancer patients as well as in AIDS patients. Nobody will do that.
Back to the Parkinson's, I have a friend who's like 55 or so, and this Parkinson's is really bad. I was pretty impressed at that little thing. So how many, to get those kinds of results, how many of them would he have to take per day and for how long?
Yeah, well, I'm sure that he's taking the classical medication, some sort of L-dopa, etc.
Yeah.
Then he should start low with only 2 tablets of the rapid energy, one in the morning and one at noontime. And he should experience an improvement in 1 or 2 weeks.
1 or 2 weeks.
Yeah, if he gets an improvement, he can increase the dosage. We are reluctant to start in with high doses because NADH makes L-dopa. And if he gets Madopa as a tablet, then he's experience overdosing effect. And then he should reduce the L-dopa or skip the L-dopa, totally after a couple of weeks. I would say he should take it until the rest of his life, like this patient I showed in the video.
That was pretty impressive.
Well, it's not only one. We did another one who was in bad shape, and he could not get up with the lift of the help of my late father. And after half an hour with NAD, he also got up and jumped. But that video was taken by myself, and I'm not a professional, whereas the video I showed was done by a very professional company. Now try it out, and they will definitely improve in terms of mobility and in terms of depression. Because many Parkinsonian patients, due to the dopamine deficiency, suffer depression.
What about like the shaking?
The shaking depends. Some people, it's getting better, and sometimes it persists. But the shaking is not the major concern of the people. The inability to move is their concern. And And also then in speaking, by the way, speaking, articulation is the first sign of Parkinson's disease because the laryngeal muscles are the most sensitive. And in Parkinson's patient, all muscles are affected. So if you have, if you know somebody and believe he has Parkinson's, you can do a test with difficult words to pronounce and to articulate. Yes?
Have you found any effect on people who clot a lot, their blood clots? For people that have clotting disorders, where their blood they get deep vein thrombosis?
No, we have no experience on that. There was another.
How long does it stay in the system?
How?
How long does it stay in your system? So
that's a good question. Normally, if you take a tablet, you can measure the concentration in the blood, let's say after an hour, and then it fades off. If you inject NADH intravenously, after 10 seconds, it's gone. It's not metabolized, but it enters the cell like the white blood cells, etc. The tablet, let's say the effect of the tablet, lasts 4 to 6 hours. And the injection, the IV, is only for 1 or 2 hours with an enormous improvement, but then it fades off much faster. Okay. Yeah?
One last thing, sorry.
Yeah.
Conversation here, but I'm curious, since you had mentioned hepatitis, can it also treat someone with cirrhosis in their liver?
Cirrhosis, I cannot recall a single patient, but I think it may help. I mean, you should give it a try, because it cannot do any harm. You know? What we have experienced, if you focus on the liver, it reduces the alcohol content in 1 hour or in half an hour by 1 per minute. And that's important. That means that it works on the liver. And the liver enzymes, are stimulated. And that holds also for drugs. If you are supposed to take drugs continuously, I think NADH will protect the liver from the damaging effect of many of the drugs, including cholesterol-lowering drugs. They are really harmful for the liver. Okay, it was a pleasure having you. Thank you. I keep telling my grandchildren, thank you for coming and thank you for going.